Good morning. Happy St. Patrick's Day. Welcome to the Alaska Independent Democratic Coalition's press availability. I'm the coalition leader, Representative Chris Tuck, and with me I have Andy Josephson, representing East Side, Midtown, District 17 out of Anchorage, and serving on Resources Committee. And then we have Representative Scott Kawasaki, representing District 1 out of Fairbanks, serving on Finance Committee. Visiting this week, we have the National Association of Social Workers, and then we have the Bristol Bay Partners here in Juneau. Coming up, the Senate Minority Leader Berta Gardner is sponsoring a Lunch and Learn. That's going to be Thursday afternoon at noon, and it's on Medicaid expansion, so very important. Saturday morning is the annual legislative shoot at the Juneau Gun Club, and I failed to mention we also have the Fiscal Reality Exploring Scenarios to Reclaim Budget Solvency presentation that's going to be happening Thursday from 11:30 until 1, and that will be broadcasted on Gavel to Gavel. Last week, the House voted to move the operating budget, House Bill 72. We did not support that budget. A couple reasons why. There was no Medicaid expansion in there. That's very important to us. There was a total elimination of all pre-K programs, and we had a $32 million cut to education, and the budget pretty much was serving outside interests over Alaskans. So we had a problem with one of the most important decisions that we're making in Alaska's history, this budget right here with the deficit that we have. We had a problem with the way that looked in the end, leaving the House. So it does not meet our priorities. As a coalition, we will not sacrifice or bargain our priorities, and those priorities are a lasting commitment to public education, affordable and accessible health care, making sure our communities are safer, and continue providing opportunities for Alaskans. The budget now heads over to the Senate, and we'll be watching that real close to see how that comes back in our direction. With that, I'd like to turn over to Representative Scott Kawasaki from the budget.
Thank you. Thank you, Representative Tuck. And as was mentioned, the budget did pass after 7 hours of deliberation and testimony. But I will say before that went hours and hours and hours of public testimony. Thousands of people from across the state weighed in on some of the impactful cuts that budget had on their livelihoods. Thanks to the work of the people in Alaska, thanks to the Democratic caucus members, we were able to make some restorations during the House Finance Budget Committee hearings. We restored $11 million that was cut out of the University of Alaska subcommittee. We helped bring positions back to the Southeast Forestry Timber Office, which would have been decimated if the DNR subcommittee had gotten what it wanted. We restored the money to youth courts, a valuable program to make sure that kids stay out of the criminal justice system as adults. Finally, added over $3.6 million that was cut from broadband that would have harmed schools across the state. You know, the only responsibility we have as legislators down here is to pass a budget before the end of session. And so, as the representative mentioned, the budget did pass without our support. We just believe, quite frankly, that without any early education in the state, without any senior benefit, or with a huge cut to senior benefits, no K-12 funding, and no Medicaid expansion, that those cuts were leveled on the most vulnerable, our seniors, our poor, our children, and that was not acceptable to me and for our caucus.
And the one who led with the Medicaid expansion amendment on the floor, Representative Andy Josephson.
Thank you, Representative Tuck. So there are a couple of things I want to talk about this morning. One of them is the second amendment that we offered on Thursday night, which was Medicaid expansion. You know, one of the things we value is getting as many people covered as we can get. This is something the state chamber has championed. And so we think it has bipartisan support. And we think that if all members had been able to vote their conscience, it probably could have passed on the House floor. But, you know, the shame is that this is really, for me, a very easy decision. The federal government wants to send us $145 million. They want to allow us to insure up to 40,000 Alaskans. This would bring in $1.1 billion over about 5 or 6 years. It would have a ripple effect of another $1 billion, and it would employ about 4,000 people. And I think, given that there's studies that suggest people actually will lose their lives without health insurance, that this is sort of what I call a moral imperative. A second issue I want to address is House Bill 132. I sit on the Resources Committee and Labor and Commerce, and the bill has been in both committees. This bill, its goal, its objective, is to keep what was then called House Bill 4, which is the ASAP or small line, small. And I think the governor's right that while we should see Senate Bill 138 through the process, given that many of these plans don't materialize, that is, lots of LNG plans never are successful, having an alternative is wise. And so I opposed the passage of House Bill 132. And I would note real briefly that when the small gas line creating ASAP was discussed, the dialogue in 23 committees was that if the AGEA cap of 500 MCF was lifted, all things were possible. So I think it's consistent with that. My last comment is about the operating budget. As Representative Kawasaki noted, I was particularly concerned about some of the cuts there. We now are going to go, if this budget stays as is, from 37th in the nation on pre-K programs to tied for last. I think that's terribly unfortunate. Added to that, the budget presently says that we will sever ties with the University of Washington's medical school. We'll no longer have this reciprocal relationship with it in about 3 years. That's unfortunate. We've had that for decades. The budget cuts career and technical education for the Pipeline Training Center in Fairbanks. Why would we want to do that when we're trying to build a gas line? And as Scott Kawasaki mentioned, my concern about the senior benefits is real, that we're balancing or trying to balance a budget on the backs of the seniors. So those are some of the concerns I see this week.
Okay, we'll open up to questions.
Rhonda McBride, KTVA. Well, we know that there's a governor's press conference today at 12:30 on Medicaid expansion, so people are anticipating that even though he said he wouldn't, that he may just roll out a bill. So this is a question to Andy Josephson. I know you have a bill. How do you feel if the governor rolls out a bill? Would that be okay with you?
So, sure, it would be more than okay with me. I want to go home this spring or summer to my hometown of Anchorage, and I want to have this done. And I don't care whose name is on the bill. I want to know that the right policy was adopted. And I've spoken to the governor about this. I'm not sure what his plan is. I'll learn when you learn. But I think fundamentally it makes no difference to me how this gets done. It just needs to get done.
And just a follow-up, have you seen Senator Kelly's bill, and what are your thoughts if you have seen it?
Well, I've read your good work on it, and I know that it doesn't include expansion. And so even though I understand he's a powerful member of the Senate, some might say he has a lot of authority there. I couldn't ever support that. Part of what he's saying is we need reform. I think Commissioner Davidson in her PowerPoint has shown that reform is going on right now. It began in the Parnell administration, it continues now. I think provably there are reforms amounting to $120 to $150 million right now. It's an ongoing process. But one shouldn't defer Medicaid expansion under the guise of saying we need reform first.
I don't really have anything to add other than reform and expansion go hand in hand. And you really can't have one without the other. We have seen two administrations go through Medicaid reforms that have saved, I think, roughly $132 million, was what Representative Josephson said. We know that these are ongoing. We also know that whenever the federal government wants to give us money, we've accepted it. We've accepted it in a 50-50 match for DGGS and for airborne matching, or airborne surveys in the Cook Inlet. We know that when there's road money out there, we take it, even if it's less than the 100% they're going to give us, and with the guarantee that it's going to be 90% in the subsequent year. I think it's just sort of a distraction to say that they need to have a bill. And the other thing, I think the great problem that could happen with a bill is that they add things in there that we don't want to see. And I think that I guess it'll have to come within the next 33 days for us to see those. But certainly, I want to see Medicaid expansion and reform continue on the same path that it's been going with this commissioner and this administration.
And we just simply need to stop coming up with excuses not to get the expansion going. Pat?
Pat Forgey, Alaska Dispatch News. So what do you think of the majority caucus requiring a binding budget vote? Is that a necessary evil for a majority to have? And then second off, will a Medicaid expansion bill have a better chance to pass because it isn't bound by that binding vote?
That mighty vote.
Binding vote.
Oh, binding vote. Okay, so that's a very good question. The majority has the rules that they have because that's what they want to have for their operations. That's something that they have for themselves. They've worked that out internally. That's something that we don't require. As you noticed that in our amendments, we didn't all vote the same. We're a non-binding coalition. Everybody gets a chance to vote their conscience.
Question was about the majority caucus, not the minority caucus.
And as I said, that's what they decide to do within their ranks. And in contrast, we don't have that rule for ourselves. We have on the budget, potentially, since they do have that rule in their caucus, that if they, it might make it easier for us to have a better dialogue, because we don't know what's going on internally with them, what conversations they're having by the time they come out on the floor and they oppose our amendments and they vote as a block. So we don't know what's going on behind closed doors with their discussions. Having a bill potentially may have that open dialogue necessary for people to vote their conscience through the committee process and then again on the floor.
Just to follow up from Representative Tuck, Pat, my concern would be that, as Representative Kawasaki said, we've got 33 days, 34 days, and I don't know whether either body truly wants to see that bill, my bill or a governor's bill, on the floor. I don't know that, I hope they do, but I would need to see evidence in the next 2 weeks that it's fast-tracked. And I think the idea that, well, we got to slow track it because no one knows what it does is not genuine, because there's been so much written about this. And so my concern would be it would be stalled.
Representative Kawasaki?
Yeah, this bill has seen 2.5 years of discussion from the previous administration now to this one. There's been 3 or 4 different state studies, all of which indicate the same thing relatively, that this will improve the lives of perhaps at least 40,000 people in the state of Alaska. It will be at least net neutral at the very beginning for cost because the federal government will pitch in 100% of the money at the very beginning. We've also seen that it's about $1.5 billion that we've lost since if we had originally taken expansion and reform as a package under the previous administration. As to your question about the way things are done in their caucus, I don't know what they're done. I don't know how they're done because they're behind closed doors, but I can tell you that this caucus I've been really proud of being a member of. The Independent Democratic Coalition has open meetings half an hour prior to floor. We discuss the things that are going on the floor. We've been told constantly by our leader that you vote with your constituents, not your caucus, and things tend to turn out right for us. I think that's a good rule to follow by.
And we're about the policy, not the politics of it.
And Scott, will a standalone bill have a better chance of passing because members can vote their conscience?
I hope so. I mean, I don't know. I don't know what their rules are for bills. Again, we're not behind those closed doors. But I can tell you if it got to the floor, I think we have a solid 13 votes in one caucus that can support expansion and reform.
One thing I would add to that is there are members of the majority where in the governor's race, the governor prevailed. And he ran daily on expanding Medicaid. And so I would hope that, though, that would be important to those members.
Yes.
Becky Bohr with the Associated Press. On the operating budget, several members, I think Representative Josephson was among them, who said they couldn't vote for it primarily because of the absence of Medicaid expansion. If we get a bill and a bill passes, are you more amenable, I guess, to a budget depending on what happens with what the budget looks like coming from the Senate? And then I also wanted to ask for Representative Tuck, On the budget, I think you had mentioned that it, we were serving outside interests. What did you mean by that with the operating budget? What in particular were you referring to?
Well, we had an amendment. Our first amendment was asking the oil industry to let us just pay you $500 million this year in the tax credits. Anything above that, up to $200 million, we'll postpone to the very next year. We're talking $200 million. When you look at the cuts that we're doing to public education, that's $32 million. You look at pre-K, was about $4 million. So that would help us, rather than, not that we won't make those payments. All we ask is that we make those payments a year later. And that way, we can continue with the programs that build our economy, that gives us a return on investment, and continues to provide opportunities for Alaskans in investing in our future generations. Because what we do today does determine the future. And our budgets do determine policy.
And I'll respond to Becky, the first part of her question. Becky, it's hard for me to predict what I would do in April as a final vote in the operating budget. I can tell you, though, you asked me, would it be enough if there were Medicaid expansion? It would be darn close for me, because that would be a very emotional day for me. And my sentiment might carry me through to a yes vote. But the two concerns that would still remain for me would be pre-K and properly funding K-12.
Yes.
And on the education issue, the $32 million is in the supplemental. Do you feel like that is already a decided issue? And I also wanted to ask about this, deferring on the credits. We're already, with this operating budget, we deferred on forward funding. It's only forward funded at 90% for 17. There doesn't seem to be any sense in this building that we're going to be any better off when we come back in January. So, I mean, is it wise to defer some of these obligations that we know we have? Why not just bite the bullet and do it now?
Well, one of the reasons why is because we will have savings for next year also. And if we need to dip in deeper into savings, then we'll do that. But for now, let's just see what the production, the promise that the oil industry is in producing more oil, and let's see what the price of oil does. Next question.
There has been some talk about looking at other sources of money that are already out there. Sometimes they're called reappropriations, some clawbacks, depending on whether they're capital funds or PCE, Higher Education Fund. What are your thoughts about dipping into those funds? What's off the table for you guys?
I think we should start with what the governor just did with the mega projects that were out there, with the Kodiak Launch Complex that consistently costed us over $60 million over the last half a dozen years. This caucus has fought to try and remove the funding for something that wasn't working and something that was broken. I'm glad the governor finally did that. There's money that's been clawed back for Susitna Dam, for Kabata, for all the big mega projects. And this caucus on the floor tried to pull back money for things that we also believed were unnecessary. Representative Josephson will talk to you about Braga, but certainly we also talked about the extra Susitna money that was still out there, that roughly $6 million just languishing and not being utilized and will not be utilized this year. So the clawbacks are important because we need to reprioritize what this state stands for.
Well, I've actually been, I think, frustrated that I've seen the very thing I've been concerned with, which is that authorities sometimes just are so sort of independent of state government that they act like mini sovereigns, and they commit their resources so we can't recapture or claw back those resources. But I applaud the governor's efforts in doing so. I think he's had some success. But some of this has been a surprise. I mean, for example, as Representative Kawasaki said, we had a simple amendment on the floor which said, according to the Alaska Energy Authority, they have $6 million unallocated, and they almost don't know what to do with it. Let's put it in the general fund. That was rejected. Why? You'd have to ask the majority.
And this is, we had the governor do his budget proposal. And our amendments brought us that much closer to what the governor had come up with, because we do not want to take the economy, we don't want to unnecessarily cut too deep. And I think the governor's number is a really good number to start off with. We're going to have to phase things down a little bit, but we can't do it all in 1 year.
Rhonda McBride, KTVA. I have a question about Medicaid and Senator Pete Kelly's bill. I mean, he has a lot of things in there, reforms that look like it'll take some startup money to get them going. So maybe, you know, with Medicaid expansion, perhaps might we be able to do some of those things?
Well, I would think that any type of reform, and we're still trying to figure out what reform that people want to see. And I'm glad that Pete Kelly's voicing his opinion through his bill. But any reform will take money, and so another reason why reform and expansion go hand in hand is so that we have those available monies to be able to invest in providing health care for Alaskans. And when you think about it, why is the Chamber of Commerce promoting it? Why are all these businesses interested? Is because we pay the highest price for health care in the nation. Insurance is very expensive. We're the highest cost. If you look at workman's comp, we're the highest. That all has to do with people who are uninsured going to the emergency rooms, using the most expensive health care, and we still have to cover it. Private interest is still covering that. So the private industries are looking for some relief also, and if we can reduce the costs in the state of Alaska, we all benefit. Would you like to add to that?
You know, one thing I can leave you with, Rhonda, is part of Commissioner Davidson's PowerPoint, which was excellent in Health and Social Services. She has several pages on ongoing reforms and prospective reforms. And again, you know, it's our position that we would supplant some of the money that is going out the door now with Medicaid expansion and chronic care, corrections, behavioral health. And we would save $6.6 million now. There's been actually no refutation of that. There's been no sort of rejection of that thesis. And then, in addition, we believe that, you know, as I said, reforms are ongoing, and that the net benefit is there and sort of inarguable.
And this way we can ensure a healthy, productive workforce as well. We all want our neighbors to be healthy. We all want our employees to be healthy. We all want our coworkers to be healthy. We want our children to be healthy. It's just something that is a no-brainer. It's time to do something. Yes.
On a different topic, there was a lot of discussion, especially in finance, about, with so much on the plate this year, the tight timetable with 90 days. But we haven't seen any push for a 120-day bill. We know what the Constitution says. Do you feel any obligation to try to adhere as closely as possible to the 90 days stipulated by the voter initiative, or are you comfortable that we could stay here? I mean, I guess I'm just wondering if there are so many complaints about how much needs to be done in so little time, why hasn't there been a bill to extend the session?
And that's a very good question. You look at 90 days, potentially going to 120 days, but then you also look at the budget situation that we're in right now. What can we afford? One thing that we got to be careful with as legislators is that we're asking for the public to take cuts. We need to be able to take cuts too. So the last thing that we want to do is to expand the expenses that we have here and doing the people's business.
And I'll just say that I think we can do it smarter and do it in an efficient amount of time. I applaud the leadership of the House Finance Committee for extending the public testimony. They saw that there was a need because there were people calling in up until the last minute. So they added an extra day. They added an evening time of off-net hearings so that people could testify to the budget. I will say that if we quit passing all these bills about license plates or resolutions to Congress, then and focus on the real things that are out there. I know that the press corps has been enamored with marijuana and daylight savings time, and there's a lot of other things out there besides those things, especially the budget, which is the number one and really the only constitutional thing that we need to finish within our 90-day or 120-day time frame.
And we have to stop putting hindrances on ourselves. You look at the budget subcommittee process, and now we have these new rules about, amendments have to be drafted by legal. They have to be turned in, 24 hours before. We had a time where we can do conceptual amendments. Ledge Legal typically does not draft line items for the committee letters that come out for the budget subcommittees. It's a new process. They tried starting this year, and it's a hindrance more than it is helpful. So we just got to work smarter through the budget process.
Well, one thing that Representative Kawasaki reminds me of is that I've now cast 3 votes on opening ANWR this session. Yeah, that's 55, 60 days. That's 2 more than I needed to cast. I'm happy to say every day that I want to see it open, but I just think we need to move on.
I'd like to ask you about the 2/3 milestone that we're coming up on. Just in 3 days, the session will be 2/3 over. Can you give me your assessment of what's been accomplished, where we need to go?
Well, as was said earlier, we're going to open ANWR. I mean, that's that's one accomplishment that we have is repeated talking points on that. Well, I think it's unfortunate that we have bills in committees right now. We have a bill on Medicaid expansion that was introduced on the first day of session that we still are waiting to have a hearing on. There are things that we can be doing right now to have open dialogue, to get public input, and to be able to make solid decisions for the state of Alaska. Part of the problem that we have is we have an agenda that's led by the Republican majority that they control the budget, they control the committees, they control the process. And we don't want to see committees being canceled. We want to make sure that the bills that are out there actually have hearings and we have a discussion on them. If they die, they die, but don't kill them by not hearing them.
And can I just add one more thing there is that, the Fairbanks, the Interior Delegation just had a meeting this morning to discuss the progress of the governor's bill dealing with ADA, House Bill 105 in the House, Senate Bill 50 in the Senate. Each of them got, I think, 4 referrals on each side. That is a priority bill for the Interior. It is the Interior Energy Project, the next step. The governor has shown in good faith that he's working with the Interior Delegation to make sure that it is. This legislature has hampered its progress. It's been sitting in a committee in the House Resources side. The 2 co-chairs have already signed due pass recommendations, and it's being held currently in the House Resources Committee. That's a bill that I can't see not pass, but at the same time, again, we're working on resolutions, license plates, and special days. And I think the majority might have their priorities wrong.
Could I speak on that briefly?
Yes. Mm-hmm.
I heard House Bill 105, and I think Representative Hawker asked some compelling and tough questions, and I actually applaud him for those questions. But, before us we had former conservative Senator Terrio, and Deputy Commissioner Parity, the former Speaker of the House of the Wyoming legislature. These are conservative men bringing a bill to help the interior energy crisis. And we saw the LNG trucking scheme pushed by the previous administration. It didn't work. I'm not criticizing that. It was an effort. It failed. Sometimes things don't work. This governor wants to pivot and still try and develop the LNG market in the interior. And, I'm just worried that this isn't a priority for the majority, and I don't know why it wouldn't be.
And then you also look we have 4 bills in for Aaron's Law. What's happening with that? It was something the governor would like to see put in action as well. Prior to the election this year, there was an article every day about the National Guard and the reform that needs to happen with the National Guard. And since after the election, Senator Wielkowski and myself worked very hard in trying to get a uniform code of military justice put together. We had the Office of Complex Investigation do their report and their recommendations, and so far we haven't acted on any of that. So There's things that we should have been doing all along that just aren't getting done. All right, we're at 9:30. Any other last questions before we close off? Anybody on OffNet? Well, happy St. Patrick's Day, everybody, and we'll see you next week.